Good morning, everyone. Scott Mabor here with your Medicare Missive for Wednesday, the 27th of May, my daughter's birthday. So happy birthday, Faye. Let's see, today I wanted to talk about a call I got yesterday. The woman lives a couple towns away. She's 88 years old. She lost her husband a decade or so ago. And she called because she can no longer afford her insurances. She's not exactly sure what she has, but what it sounds like is she has A and B, and she did call a carrier and claims that the carrier told her to cancel Part B. I'm assuming she misunderstood, because obviously you cannot cancel Part B. So what I believe she has is a Plan F, so a Medigap Plan F from AARP, which is now up to $345 a month in addition to the $203 for her Part B. So after going back and forth a little bit, it sounds to me like her husband signed them up for a Plan F, which back in the day was the plan, and it's never been changed. She's never touched it. It's now up to $345 a month, which she cannot afford, and she wants to cancel it. So we spoke about some options. There's a Plan G and a Plan N, both of which would be cheaper. Plan G especially would offer almost identical coverage, with the exception of having the $300 deductible covered, and save her approximately $100 a month or so. So that was one thing. It also seems as if she's never had a drug plan. So that's another issue. However, because she's not had a drug plan for 20 or so years, adding one's going to be a big penalty, and the penalty would be paid monthly. So if she doesn't feel she needs a drug plan, I think at this point, drug plan's probably not the best option. The other thing was, nobody has ever told her she has a very small pension, a couple $100 a month, and about $1,000 in Social Security. That's it. And I said, how come you are not on any assistance? Low income subsidy, Quilby, Mass Health, any of the assistance programs from the federal or state governments? And she said, because I get by. I'm good at pinching pennies, was her expression. And nobody has ever suggested to her, why don't you apply? She has no computer. She's very nervous about making decisions on her own. I offered to go meet with her. So Friday, I'm going to meet with her and her daughter-in-law, to explain her options and get her squared away for June 1st. At the very least, we'll switch her Plan F to a G or an N, to save her some money and give her a comparable coverage. Drug plan I can't touch. However, I am going to help her apply for assistance, because if she gets assistance, not that she needs it for drug costs, but if she gets assistance, it would waive the penalty, so she could get drug coverage and go on that. And depending on the level of assistance, it may actually pay for her Part B. It may eliminate the need for the Medigap plan, which is $250 a month. So there's some things we can do to help her, and unfortunately nobody ever has. She's called the carrier twice, got kind of confusing information, but it may be that it's being misinterpreted, and she admitted that. She doesn't understand what she's talking about and doesn't know what to ask them and doesn't understand their answers. She has nobody to guide her. So not that I meet many of my clients in person these days, but I did offer to drive over to her home Friday morning, meet with her and her daughter-in-law, and see if we can get her in better shape. But get some help. This is confusing, and in her case, she's got a Plan F. If you have a Plan F, or you're in Massachusetts, you have a Plan 1, think about changing it. You're paying way too much money. It's now almost $100 more a month than a Plan G equivalent or a 1A in Mass. And the only thing it's covering is that $300 Part B deductible. It's the only difference between the two plans. You're paying $1,200 a year to cover a $300 deductible. That's insane. You need to change that. Let me know if I can help. Have a great day. Thank you for watching. Tell your friends, tell your family, and have a great day. Thanks.